For about a decade now, the World Health Organization has recommended treating tuberculosis by using a 4-drug fixed-dose combination of medication, which has the same amount of pharmaceutical ingredients as the 14 pills that have traditionally been used. But the logic of fewer pills, a simpler routine for sick patients, has not yet sunk in among many doctors. For a variety of reasons, health professionals treating TB have resisted prescribing fewer pills. But a new study in the high TB incidence areas of Africa, Asia, and Latin America confirms that the 4-drug combination of pills is just as effective as the 14-pill regimen. Dr. Christian Lienhardt conducted the research in several countries comparing the new and old treatment regimens.
And it's true, something which is true everywhere in the world. Patients don't like to take too many pills, and if you have to take 14 pills every day, for 6 months, and you have the choice with 4, I would prefer, and a lot of people would prefer to go to the 4.
But Lienhardt says the 4-pill treatment has been resisted because many care providers intuitively doubt it would be as effective.
There is a type of common sense, and mainly among the health staff, that when you take all these drugs, then you know that each of them had a very, very good activity. And when you combine, maybe the risk is that to lose a little bit of the activity. And that's a type of common sense that might unfortunately take place mainly among the care providers rather than the patients.
Tuberculosis is an aggressive bacterial disease that attacks the lungs and spreads rapidly among people with weakened immune systems. It kills nearly 2 million people worldwide every year. Experts say it's treatable if medication is taken as prescribed. In the classical treatment, TB patients are usually prescribed 12 to 20 pills daily, depending on their weight. Having the combination drug would improve the chances that patients would finish taking the entire dose. In the 11-country study by Lienhardt and his colleagues, patients were divided into 2 groups. One got the combination pills and the other took the same drugs in individual pills. The clinical trial found the combination pills to be equally effective.
We need to really make the case very strongly that using this type of drugs is having the same efficacy as the normal drugs, but again, is a very good tool to avoid the emergence of drug resistance.
More powerful medicines are needed for drug-resistant strains, and some are even hard to treat with any drugs. Dr. Lee Reichman has worked to control TB for 40 years.
Multi-drug resistant TB and extensively drug-resistant TB are failures of the system. TB is treatable and preventable. And if we find TB properly and treat TB properly, A, they're cured, and B, they don't develop drug-resistant TB, whether it be multi-drug or extensively drug.
Researchers aim to popularize the 4-drug fixed-dose combination pills among international public health officials, policymakers, and patients' organizations as part of the continuing campaign to eradicate TB. Vidushi Sinha, VOA News, Washington.